I am not available on OnlyFans.
Dang
Don't
it.
go looking.
It's okay, I already looked.
So
I'm just kidding.
Online personal trainer. Rolin, this hurts too much. I need you to suck it up. Okay? Oh, sorry. I mean, I need you to let me know and I'll back off. Okay?
No one will ever know.
Except the people who watch.
Yeah. Poker face.
Good, relax the upper body. Good. There we go. Got it. Rolin, good to see you again.
Nice to meet you.
Rolin is quickly becoming a regular patient here. He is a very, very fit and active online personal trainer who obviously is dealing with a couple of issues, hence why he's coming in to see me. I'm going to let him kind of give us the summary of what he originally came in with and what we've been doing so far, what's been working well. So Rolin, you want to run us through that?
So right now what we've been working on is I've had some issues between the shoulder blade region, my rhomboids and my mid-traps. I suffered a neck injury several years back, and from doing a 1.5 backflip. You don't want to do a half of a backflip at any point in time.
Yeah, ow.
Okay. Right? So especially from 2 stories up into a foam pit, so it's not ideal.
At least it wasn't on the concrete. It wasn't just parkour.
No.
Like out. Okay, all right. Because that's God. I've seen
Well,
a
it's
couple of those
definitely
injuries.
driven by ego.
Okay. Yeah, most injuries are actually.
Yeah.
Fun fact, at least that I see. Yeah. Sorry, you were saying?
Oh, no problem. So essentially, since that point in time, when I deadlift or if I do a move called a front lever, anything that pulls my shoulders forward, even if I'm not visibly looking this like I'm doing this, I will feel some strain between the shoulder blades, and it kind of feels like the muscles wants to be pulled off of the scap itself. So we've been working on that so far. We've been doing some scraping, which I'm sure Adam will talk a little bit more about.
Yeah. All right. So yeah, no. As he mentioned, it really is that kind of forward protrusion of the shoulders that really aggravate your complaint the most, right? So yes, you have your rhomboids back there. You also have your serratus anterior, which are kind of like your angel wing muscles. I'll throw up a diagram of them right there so you guys see. But they're the ones that are responsible for that last little bit of the shoulders there. So when scraping the rhomboids, we're also working the serratus anterior muscle in that way. And I don't think I actually... Did I mention those muscles to you before, or they just come to me right now? I think they're just coming to me right now.
I've known of them myself.
You would know about them given your background. But no, that's what we've been working. We've been seeing, hopefully, a good response so far. We've been treating the neck. We were also treating the low back. What was that for?
And so the low back, so that was actually the original issue I came in with. But that had gotten, that's been improving since I've changed my sleep patterns. But the issue itself was that I had suffered some injuries from powerlifting many years back, and on and off I've had pains here and there, but nothing crazy. In the last several months since moving out to Oakville, just sleeping is aggravating it, and it kind of starts at the lower part of my spine and wraps around to my QL region. So when I sleep, if I sleep on my side and I sleep on the wrong side, can't recall which side now, but I know the pain is on the left. I think it's when I sleep on my right side. It just feels like it seizes up, and it's this dull ache that keeps me from going back to sleep once I've awoken.
Now, since you've changed your sleeping orientation, you mentioned that has been greatly improved. Yeah, are we backpedaling a little bit?
We have backpedaled a little bit.
Okay.
It's better as a whole.
Okay.
Largely, I think, because I've elevated my feet, as we've talked about. I switched the orientation on the bed, and I elevated them much more than I used to, like significantly more. But I've also just made sure my sleep would be better because I locked in the same bedtime within 30 minutes, one way or the other, and the same wake time every single day without fail.
So Rolin's cleaned up his sleep hygiene a lot, which will help, especially if you're pushing heavy physical activity goals, right? Like, I mean, you can eat right, you can be as active as you want to, but if your sleep hygiene's poor, you're only as strong as your recovery or your weakest link in this case. So that's been beneficial. As well, like when you first came in, you mentioned that a lot of the issues you were having, yes, were related to sleep. You changed the orientation of the mattress itself, and then saw a great improvement, right?
Yeah.
Now, how old was the mattress? I think it was on like 5-6 years?
I want to say, something like that.
Okay. Most mattresses these days are crap and are kind of designed by nature to fail within 5 years, you know, capitalism yet. But with that, you will eventually lose some support that was previously present and perhaps was necessary to prevent getting these kind of stiffnesses coming up, right? So a lot of people will jump like, oh, it's your mattress, and like actually very often it's not. It's because of the way you're moving or something. In this case, a large part of it was due to your mattress and probably still is. Change the orientation has helped you a lot, but still with that long of a time frame having passed, you'll explore a new mattress soon. Yeah. All right, but all the same, glad you're feeling better with that.
Thank you, man. Also switched up the pillows a little bit.
Yeah, that will help the neck as well, right? So what we're going to do today is we're going to do a reassessment so that you guys can see some of the physical exams and stuff you've become used to on this channel, and then we'll get into the treatment. Okay? Sounds good. All right, so I'm going to need you to start by bringing your chin down to your chest for me. Okay. Does that provoke any of the neck pain that you're talking about back here at all?
Nope.
No? All right, and what if I do something kind of mean, push it further?
Nope, just more stretch on the left
Just
side
more
than the right
stretch on
side.
the left side than the right. Okay, come back up. Yeah. Look up towards the ceiling for me, please. How's that?
Fine, no issues.
All right. How's now?
More on the left side.
More on left, just left
Everything
side
on my
dominant.
left. Yeah, everything on my left is jacked up.
I'll get you to rotate as far as you can to the left.
Okay.
Just your head.
Just my head. Okay.
Go ahead. We can get to about 50 degrees. All right, now rotate as far as you can to the right. We can get to 45 degrees. That's pretty close. I'd say that's symmetrical. Face forward. Okay. Bring your left ear down to your left shoulder for me, please. Good. We got about 40 degrees. Right ear to right shoulder. 45. Again, a little bit. So we got a little bit more range of motion available to us when we turn to the right as compared to the left. That does kind of sync up with the feeling more tightness on the left side, because if those muscles don't want to let go as much, yes, it's going to limit your range of motion on the contralateral or the other side, but it's not that great of a difference, so it's not overly concerning. Still something we can address. I'll get you to give yourself a tight hug for me, please.
I love myself.
Aw, you're worth loving, okay? Everybody who watches this channel is worth loving, and the people who don't too. I'll get you to rotate as far as you can to the left, but especially the people who are subscribed. All right, so we can get you to about 45 degrees. Now as far as you can to the right. Okay, so a lot less rotation than I would have expected on both sides here.
Yeah, that triggers this.
Okay, so when he does, was that when you rotate to the right, it's worse on the left?
Yep.
Yeah, okay. Less rotation on the right side too. So we have these muscles called our paraspinal muscles, para meaning next to, spinal meaning spine, that run literally from the top of our head all the way down, all the way up here, down our entire spine, all the way that insert into the sacrum. Paraspinal muscles, multifidus is the primary example. So if you are rotating all the way to one side, not even moving your low back, but you feel that pain in your low back, entirely possible, because we have lots of structures that will extend and are affected just by that completely other area movement, right? That's why it's very important anytime you have one area of concern to look both above and below the chain, because those are being affected as well. Long-winded explanation, but there we go. I'll get you to stand up for me, please. Please bend down. No, just keep facing the window there. Bend down, touch your toes. Let me know if that provokes any lower back discomfort.
Nope.
Nope, good. Come back up the other way for me. And extend backwards. That's the opposite direction. Anything low back with that?
No.
There's a little pop. Is that your sternum?
Yeah.
Yeah, okay.
When I started off, I felt something, and then the more I went,
as you went further, it was okay.
Yeah.
All right. Get you to have a seat now.
Okay.
Sure, there are chiropractors that are on OnlyFans.
You know, okay, I actually wish I wasn't recording, but like I know of at least one.
Yeah.
All right. And it's very disheartening to see.
Yeah.
I'm not going to say her name.
Yeah.
But I did not stumble across her OnlyFans. I stumbled across a post from Reddit. All right, saying, hey, what are our thoughts on this? And, you know, for science purposes, I'm kidding. But, like, no, that is a thing, yes.
Because people would pay to hear cracks, and what's more, see it in certain lights.
Okay, yes, you're correct. But
yeah.
Anyways, I am not available on OnlyFans. So
Dang
don't
it.
go looking. Oh, it won't work.
It's okay, I already looked.
So
I'm just kidding.
My hands are going on your back now, okay?
Yeah.
All right, so we're going to start down low. Remember, Rolin's original complaint was in relation to that lumbar spine, specifically the left side.
Yeah.
And that does feel a little bit tighter. Does it feel more tender when I poke in there for you, or not particularly?
It's not tender, but it does shoot up a couple vertebrae too, and on the left, yeah.
Okay, gotcha.
Yeah. Mm-hmm. And I don't know if you'll remember, but it was when I had the last time I had an X-ray, which I'd love to have another one if you could refer me at some point.
I can, yes. We just got to find reason for it. But what's going on?
But the last time I had the X-ray, it showed that the S1, L5,
Yep.
where there was the decreased space between the two discs.
Mm-hmm.
And I just love to see, has that gotten worse over time, and is that one of the things that's compounding this?
So, question for you: when you got that X-ray, how long ago was it?
This is a while back, at least 2 years.
At least 2 years.
Not
Okay.
that long, actually.
And did they give you a diagnosis for that, or did they just mention decreased space?
I don't remember a diagnosis, so
Ooh,
probably
okay.
not.
A little tender there.
Yeah. I probably still have access to that, so I could.
Yeah, I
bring
wouldn't mind
it to you.
taking a look at it for you. Yeah. And if it persists, if this low back discomfort persists, we can absolutely rationalize that as another referral.
Okay.
Just take a big breath in for me, all the way out. Okay, in, all the way out. In, all the way out. Nothing. We might need to actually scrape first. Usually we can get through before that, but you could also just be doing great. Breath in, all the way out. Okay. All right, let's get into the scraping, okay? So again, we were having mild decreases in the right range of motion as compared to the left, which coincides with the tension that he's feeling more predominantly on the left side of his body. So let's just go ahead and do some MRT, myofascial release technique, and trigger point work through his left C-spine paraspinals. Now, if this is too tender, or if this hurts too much, I need you to suck it up, okay? Oh, sorry, I need you to let me know and I'll back off, okay?
No one will ever know.
Except the people who watch.
Yeah. Poker face.
The thousands of, what's it called?
Subscribe.
Witnesses that see this. A little jumpiness down lower, There we go. Let's check out the right side. There we go. All right, I'm gonna bring this arm straight up. Right there, good. Bottom leg straight, top one bent. Scooch the hips towards me, please. Scooch, good. Awesome, all right. And breath in for me, all the way out. Roll towards me, relax the upper body. There we go, that side cooperated very well. Bring this leg up for me.
Okay.
Good. Hook around there. Hips towards me, please. Thank you. Take this, and I'm gonna get you hold just right there. Nice. All right, and I need to get right in there. And once again, all the way out. Good, relax the upper body. Good. There we go. Got it. Whew. Good job. Whew. That took some work. I'm gonna roll this down by 1.
Okay.
Okay. I don't know how far 1 is, but
Okay.
that's how far we're going. There we
Hopefully
go.
it's not crack.
No, there's no crack. Don't
Okay.
you worry. All right.
I was gonna say, if crack shows, you better get that OF rolling.
Yeah, exactly. Hence the previous conversation.
I demand compensation.
Oh my god. All right. Here we go. Okay, so usually around this time, well, actually, let me do a brief little recap of what this is for people. First off, is this bothering you at all, or is this okay?
No, so far so
Perfect.
good.
Okay, perfect. So we're gonna. Rolin's responded really well to fascial work, all right, specifically with his upper trap / his serratus complaint. So we're definitely including that as a staple going forward for him. Usually at this time, Rolin, I'd like to ask my patients that are being filmed a question about themselves, give the audience a chance to connect to them. And that question for you is to tell us something about your job. We do know that you're a personal trainer and entrepreneur. Tell us something about your job that you find to be rewarding.
Well, being a personal trainer, I think it's one of the obvious ones is just seeing people come in and celebrate the victories they've had outside of the gym.
Mm-hmm.
So I'll talk about one of my clients without saying her name. She started about 2 months ago,
Okay.
and she didn't have very much confidence in carrying things like from home from the grocery store. And this is a woman in her early 40s, and she'd be like struggling to lift 25 pounds, and we trained the basic movements, and she came back several times and just like, man, I carry all the groceries back in one go. And like, as cool as it is to do all the stuff in the gym, lift heavy weights, all this other stuff, very seldomly do people celebrate the small wins of their daily lives getting easier.
I agree. That would be very. That's why I like being a chiropractor, man. Like,
Right?
as far as that goes, like, yes, obviously, like you and I, we work out for the reasons of working out itself. Health benefits, obviously, but there's a physique aspect at play there too.
Yeah.
But then once you start to lose confidence in what your body can do, regaining it back. Oh, that is one of the best feelings that you could possibly hope to get that I've seen in my patient base.
Yep.
So I'm happy to hear that you have a very comparable experience with your own client base too. That's good.
Yeah, I'm excited to be able to access my full potential again as we fix these problems.
Oh, we'll get there. Don't you worry. You're tough, you're strong, you're tough, you're strong. one thing that's interesting, worth noting here, is that Rolin again is commenting that most of his tightness, most of his pain is felt up between those shoulder blades on that scapular protraction movement. Well, if we look, the only place we're really getting any formation of that petechiae, that fascial release, is right between those shoulder blades. All right, like I mean, we scraped the lower back, the traps, the middle back proper, all pretty evenly, but we're only getting that presence of fascial adhesions, fascial restrictions exactly where he's complaining of the most pain. So that's indicative, or at least maybe not indicative, but suggestive of a large portion of this complaint that he's getting, this protraction movement being irritable, is due to fascia not wanting to give him full available range of motion. So we keep on working this. I'm confident we're going to keep seeing progression until he can get back into doing the movements, the front levers and the heavy deadlifts that he was commenting on not being able to do because of this rhomboid, the serratus anterior pain. So overall, I'm pretty confident with you, Rolin. That's what I'm trying to say. That's good news. We like confidence, right? Yeah. All right. Breath in for me. All the way out. There we go. In. All the way out. There's another little one. Definitely more subtle, but much easier to do that without having the camera direct over top of you. That is for certain on my own end. So Rolin's definitely got more tightness on that left side, as we've already discovered, kind of all the way from the base of the neck down past the shoulder blade. So it makes sense to do as much kind of activity in through here as we can during the session. So I'm going to get you to start just by looking up into the left for me there. Other left. There you go. And I'll get you to now please slowly look down into the right. People who watch the channel regularly will be familiar with this technique, the MRT. We did this to his neck earlier. Now we're going to do it to more stuff. I'll get you to look up into the left once again. And slowly down to right.
I love this kind of stuff.
Oh, good.
I always just called it like active release stuff.
Yeah, so I mean, ART and MRT, active release therapy versus myofascial release therapy, they both are based off of primarily trigger points. Okay, finding areas that are focally hypersensitive in taut skeletal muscle, yada yada. But MRT, the gist of it is that I will take a pin, so I will take, in this case, my very pointy elbow, put it right in that area, and then get you to move, thereby stretching the muscle against my pin. ART is just the pin itself. So that's really the only difference between the two. That and ART is branded. You have to pay thousands of dollars to remain licensed in ART. Anybody can do MRT provided they actually know how to do MRT. So
Gotcha.
yeah. Here's your face forward. To left ear to left shoulder, please.
Left ear, left shoulder.
Okay, that's rotation. That's okay. We're gonna tilt.
Oh,
there we go.
oh,
You
I
got
said-
it.
I said
Okay.
turn.
No, my bad. Right ear to right shoulder, tilt. Good. Left to left.
Definitely tight there.
Right to right. Just a lot. Yeah, we'll take care of it. Ooh. Left to left. Right to right. Left to left. Right to right. And left to left. Right to right. Nice. Alright, so let's go ahead and just keep it symmetrical. We'll do the other side too. I get you to look up into the right. I'm not anticipating this to be as tender or painful. Get you to slowly look down to the left. Go ahead. Good. Up to right. Down to left. Up to right. Down to left. Up to right. Down to left. And up to right. Down to left. Good stuff. Face forward, please. Tilt right ear to right shoulder. Hands left to left. Right to right. Left to left. Good. Right to right.
Definitely feel your bony
yeah.
elbow more on this side.
Oh yeah, I got some abnormally bony elbows.
Yeah.
My size, right to right.
Well, it doesn't match up.
No, they really doesn't.
Yeah.
Like just for the camera there, like I mean, look at that angle. There's literally like a sweep there. It's I don't know what.
It's bony as hell.
I was made for this job. That's true.
He covered the skeleton because he wanted to show off his elbows
I
instead.
got insecure there. That was the only elbow that was pointed in mine. Was one with nothing else on it. I'll get you to shrug the shoulders up for me. Slowly lower down, please. Good. Up. Slowly lower down, please. And up. Slowly lower down, please. Good stuff. Rolin, how did you find all of that?
It was pretty great. My neck feels much more freed up, so I've got a lot more freedom of movement. And by default, because of that, my shoulders feel a little bit less heavy, if you will. So that's fantastic.
Good.
Bent over, touch my toes. Everything feels like I'm moving pretty well in the lower body.
Hope so. Yeah.
So overall, great session.
Happy to hear. Are you doing any kind of physical activity after this? Are you going to work out? Are you going to...
No,
what are you up to?
Today I've already worked out this morning.
All right, you got it done.
But yeah, so I'm good now. But I actually wanted to ask you about spinal decompression.
Yeah.
So we talked about how my S1 and my L5 there's less space between this as per my last X-ray. And I have been doing some decompression via hanging or going on a dip bar, letting my lower body kind of disassociate.
Yeah.
And I'm curious to hear your thoughts about like ways to progress this.
So with that, like first let's talk about the x-ray there, because it's very common that people will get an x-ray and just with normal like usage, everyday living, people will get decreased disc or joint spaces or whatever. Some clinicians will label that as degenerative joint disease or degenerative disc disease. I want to emphasize that decreased joint space is pretty normal as you live your life. Okay, like me, I was given the diagnosis degenerative disc disease. Granted, it was mild, but I was given that in my early 20s because there was some narrowing of the disc space between my vertebrae, and the practitioner thought this was potentially because I did heavy deadlifts. Okay, and I have no back pain on a regular basis, so this diagnosis it's a moot point. But that doesn't mean that there aren't examples where there is decreased joint space and you do get a little bit of symptomatology from it. Just predominantly, most likely, it's not. Now, with you getting some pain there that is then relieved with distraction, yes, it could be due to this joint space. It could also be due to just letting the muscle stretch itself out. But regardless, what we do know is that distraction feels good for you, period. It feels relieving. So as far as how to progress that, I'm actually a huge fan that you are doing the dead hangs already. All right, there are people who can, you can go to a clinic, you can find somebody who's bought a very expensive $20,000 decompression table and use that, and that's definitely a good option for people who don't have the upper body strength to kind of hold themselves up. But if you are a relatively fit individual, you're able to do a dead hang. Highly recommend you just do this yourself in a gym with a bar setting, because you're going to be saving a lot of money that way, and then you can modulate it yourself. So progressing that dead hang, super simple. I progress it the same way that you would progress any other kind of resistance exercise. You just increase the load, right? In this case, you could use ankle weights, or you could hold a dumbbell or something in with your feet. The one thing I wouldn't suggest is getting a weight belt and wrapping that around your low back and loading up weight that way. It might make sense initially because that's how you would do a weighted pull-up, but in doing that, if the intent is to stretch out and distract the back, you're going to end up tilting the pelvis with the position of that weight belt. So just find a different way to load up at the feet base. That's going to further pull you down, further distract and further dissociate, and should help decrease your pain further. Of course, if this is your first time doing this, stay away from the weight. Just rely on your body weight, and also keep a step or a stool or something nearby that you're able to step onto should the pain for whatever whatever reason start to become worse, or you feel your grip loosening.
Right.
Right. Does that answer your question?
Yeah, it does.
Awesome.
And
Right.
on that
What else
same
you got?
tip, I'll also say, because you mentioned if you don't have enough grip strength to hang on, a great tip is to
Oh, yeah,
use like a
listen
dip
in.
bar.
Yeah.
Use a dip bar and just, I won't do it on this chair
Thank
before I
you.
break it,
Yeah.
but you can go here and hold yourself up relatively easy if you just lock your joints.
Exactly.
And then still do all the same progressions.
That's a great example of modifying an exercise that you are not able to complete to be one that you are able to complete. So I love when I get to work with other people who have that kind of kinesiology knowledge. It's really, there you go.
Yeah.
Any other questions or concerns or comments for today?
No, I've got nothing.
No?
Thank
Awesome.
you.
Well, thanks for coming in, Rolin. Very much appreciated. We'll end on the handshake there, and I'll see you soon.
Don't forget to like, comment, and subscribe.
Thank you, Rolin.